Welcome back to the Health Longevity Secrets Show with your host, Dr. Robert Lufkin. His book, titled Lies I Taught in Medical School, is a New York Times bestseller. See the show notes for a link to download a free chapter. And now, please enjoy this week's episode as we look at decentralizing health and longevity with Jasmine Smith.
What if the future of healthcare lies in our ability to decentralize it? This episode takes us on an insightful journey with Jasmine Smith, the visionary CEO of Rejuve AI. She shares her fascinating transition from health information management to leading a groundbreaking project in decentralized health and wellness. The transformation from Web 2.0 to Web 3.0 is laid bare, with Jasmine revealing how this evolution empowers individuals by taking control away from traditional central data center entities and addressing challenges like scalability and user experience. We also uncover how technologies such as IPFS and Filecoin are poised to revolutionize sectors like healthcare, particularly in data handling and security. We venture into the intersection of AI, blockchain, and longevity research through Rejuve AI's decentralized platform. This network ambitiously crowdsources health data from users, leveraging wearable devices and health surveys, with future plans for genomic data integration. By personalizing health protocols, Rejuve AI aims to deepen users' understanding of their own physiological data, marking a significant stride towards democratizing health information. There's a burgeoning movement towards decentralized science, with comparisons drawn to initiatives like Matt Kaberlein's crowdsource database for rapamycin and VitaDAO's innovative research efforts. As we explore decentralized science further, the episode delves into how it fosters fairness, reduces bias, and accelerates research, especially in the field of aging. VitaDAO's novel approach to funding biotech startups through tokenized intellectual property is highlighted, offering a glimpse into the future of rapid therapy development. The synergy between VitaDAO and Rejuve AI is palpable, with both entities pushing the boundaries of health innovation. Listeners can anticipate the launch of the Rejuve AI app in early 2025. This is a tool designed to enhance user health and longevity through a freemium model backed by the RJV token. These initiatives are set to transform healthcare into a more collaborative and data-driven industry, promising a healthier future for all. This episode is sponsored by SciFox Health. One of the most common questions I get asked is which blood tests I check myself on a regular basis. Well, I check 17 biomarkers, but the secret is I'm able to do everything from the convenience of my home. I collect a sample with just a simple finger stick like this. You don't need to be a doctor to do it. Then I just mail it in and wait for the results. SciFox Health makes it possible. Use the link below to get 15% off. This episode is brought to you by L Nutra, maker of the Prolong fasting mimicking diet. If you'd like to try it, use the link in the show notes for 20% off.
And now, please enjoy this week's episode.
Welcome to the program.
Hi, thanks so much for inviting me.
I think this is the first podcast we've done from Darwin, Australia. So what time is it there now?
It's about 6:30 a.m. Right in the morning, Darwin, just near sunrise.
Yeah, it looks pretty bright out here. It's California time. It's about 2:00. So yeah, well, I'm glad you can make it, and I'm so excited about our conversation today and we get to dive into stuff like decentralized health and wellness and blockchain and Web 3.0 and the potential for transforming our health and longevity. But before we get to do that, and also talk about the exciting things you're doing, but before we do that, maybe you could just start things off by tell us a little bit about your background or how you came to be interested in this area.
Yeah. So my original background is actually in health information management. So that's all like analyzing the medical records and translating them into information for billing entities. So I was doing that for a while. I've always been passionate about health and wellness in general. And at some point in time, I just kind of realized that I wasn't really helping anybody be healthy by sort of calculating how much money someone gets paid off of someone's suffering and all that kind of a thing. So I found out about this actual project called Singularity Net that was doing a lot of cool humanitarian related stuff in AI and blockchain. And I started getting involved on a volunteer basis. And after a couple of years, there was kind of a spin-off entity that was focused on longevity called Rejuve. And, I kind of got involved with that formally and eventually came, to be the leader of that project.
Oh, great. Well, there's a lot of jargon there, and I just for our audience, just so we don't lose anybody and get everybody up to speed. Let's start. Well, first of all, we know what the web is, right? The internet, and what is Web 3.0? First of all, let's set the foundation with that.
Yeah, so I guess Web 2, as kind of it's implied by calling it 3, is kind of the interaction platform by which we do now, as to where everything is kind of central servers. We're all interacting through kind of a limited body of channels, in order to kind of interconnect everything online. I mean, unless you're kind of doing dark web or strange setups, which most people aren't. And so Web3 is more about kind of a peer-to-peer system. So it's about building new infrastructure that allows, for instance, computing to be done, remotely and individually in different places, for data to be actually owned by people that are putting the data out there, and to actually be able to do transactions between one another as well, that don't involve central entities, like banks and whatnot, controlling that. And so it's all really about bringing it more back to the user-centric focus, and the governance of such a protocol being democratized and controlled by everyone versus controlled by a small few.
Yeah, I mean, immediately one could see the advantages and the power to the individual of that, because right now, with the sort of, as you say, the Web 2.0, we're largely relying on centralized servers through very few large providers that, are web hosting us and are controlled by a very few. So the idea that this would be running more independently and peer-to-peer is really exciting for all sorts of reasons. And just where are we in Web 3.0? What sort of penetration is it? What sort of software is available now for that? And what are the challenges with that?
Yeah, so there definitely are some key challenges, and most of it is related to, the tech stacks themselves and making things work in this kind of scalable and quick way that we need to do business, pretty much to conduct larger scale operations than just, people's small projects and whatnot. Right now, the Web3 space is mostly known for cryptocurrencies, and that's, ways to pretty much do transactions digitally. There's lots of projects emerging, and that space is definitely maturing, as to where people are focusing less on kind of things that are just hype and whatnot, and more on projects that are actually building real infrastructure or real world products and services. And then, yeah, on the computation side, there's definitely things happening. There's this IPFS, if I'm saying the abbreviation right, which is interplanetary file storage. So there is and there's Filecoin and all these different things that are handling the data decentralization portion. And then so the next level that's being built is the actual computation level, to be able to process large amounts of data to the volumes needed for AI. Let's see where else we are. But yeah, I would say it's most known basically at this moment for crypto. And there's definitely a lot of UX and UI kind of user experience things to resolve in order to really roll it out to that next level. But it's definitely a massive community at this point in time.
So yeah, the blockchain and the cryptocurrency obviously provide the decentralized aspect of it, so one could do transactions and things like that. And really, yeah, exciting possibilities. Is IPPS, Interplanetary File System? I remember that from 5 years ago. Is it now to the point where, and that the idea there basically is, correct me if I'm wrong, but basically it's sort of Amazon Web Services storage, only decentralized. So individuals store stuff on their own computers, and then they share and benefit from it and everything. But is that, as a hospital healthcare administrator, are you seeing performance levels for use cases with that would, that we could trust hospital data and real world healthcare data on it yet, or is it still to come?
Yeah, I mean, I think there's definitely infrastructure to be built there. I mean, yeah, there's definitely huge benefit in being able to have decentralized data storage. You can obviously make it a lot safer. But yeah, there's still kind of work to be done, for instance, in figuring out how something that's kind of acted upon by multiple parties can meet certain standards like HIPAA, for instance. Being able to be compliant with the regulations overall, besides just the actual kind of safety portion of it. That's probably one of the biggest challenges. And yeah, also just as I mentioned, the user interaction of, how to integrate that into systems like hospitals without being, a computer hacker or something of that nature. It's kind of, it's a bit intricate at the moment, but there's definitely a lot of core infrastructure being built now, people focusing on these areas. So it's definitely getting there.
Oh, I mean, very exciting to be able to apply this to longevity and healthcare. I think is really tantalizing and has such great potential. Let's continue our unpacking and maybe speak for a moment. Tell us about Singularity Net and what's remarkable about that, and what inspired you from that to then move on to your current project.
Um, yeah, so I actually found out about it just on a random video that was actually about robots, and they were having a debate. And I just thought, well, this is something quite interesting that humanity should be paying attention to, more than other stuff that's being highlighted. And then I just started digging deeper into who was behind it and what they were doing. And I found that they were actually trying to create or make sure that if there ever is an artificial general intelligence system, as now people are beginning to actually talk about, which wasn't is popular like 5, 6 years ago, that this has human centric values in it, that it actually has things like, compassion and benevolence and, kind of avoiding those Terminator-esque scenarios that we see in the science fiction movies. And I felt like that was an important effort to be a part of. I wanted to be a part of making the world a better place and, influencing the future of how our technology is going to be rolled out. Because new technology always is a double-edged sword, right? It can do a lot of good for humanity and society, or it can do a lot of bad. So
Yeah, certainly. I mean, I think no one would argue that there are certainly potential dangers with AGI, general artificial intelligence, and we have to be aware of them. And the Singularity Net, then, is it mainly, do you hope to influence the safety through policy recommendations, or is it actual computer software and that sort of thing?
it's kind of all of the above. I mean, it of course began on the technical level of actually, operating how the system works, and part of that was that decentralization value that we were talking about. The fact that multiple people from around the world can actually contribute to how this technology is developed, so it's not, only representing one narrative or one population or ideal, but it's actually serving all of humanity. And then there's also all of these. So Singularity Net kind of branched from, just being one mothership to all of these different projects. And we've got projects in longevity, in computing, even music. So all these different, societal pillars are being represented, and they're, even smart cities like this. So they're in like sort of all of these different pillars, trying to make sure that this new, future society is something that people actually can enjoy being in, and that doesn't just make the problems of today even worse.
Yeah, no, that's fascinating. I love it. I mean, I could talk forever on AI and go down that rabbit hole, but out of mercy for our listeners, let's transition into no, I mean, it's a fascinating topic, but I want to transition into specifically Singularity AI. Then it has decentralized aspects that appeal to you for health and longevity, and what how does that play out, or what were the benefits of Singularity Net you saw would be valuable for health and longevity?
So this kind of comes back to the CEO and our co-founder Dr. Ben Goertzel was always a passionate longevity enthusiast. He's been involved in longevity community for quite a while, even though he was more on the science computer tech side. So this project was one of the earliest ideated spin-off projects, and with the idea that if the AI or AGI is one of its top goals is helping us live longer, then that's kind of antithetical to getting rid of us, right? So that's the kind of the core reason of why something like that is integral to the ecosystem. And so I joined in 2021 and started developing the product roadmap for our longevity app, which is our flagship product that we've been working on and aiming to bring to market soon. And it kind of also grew into a wider kind of ecosystem around health and wellness that we are doing on blockchain and Web3 and biohacking community, all that kind of thing.
Oh yeah. So I mean, I guess AGI could want us to live longer if they were using us for food or something like that. But that's well. So to your point, so what particular tools or value is this technology bringing, particularly to health and longevity? Like, is it helping with research and crowdfunding, DeSci, distributed science, that kind of thing? Or is it education? Or is it guardrails for knowledge errors and, AI hallucinations, that kind of stuff? Or maybe fill it out a little bit more. Yeah. What is it actually doing?
Sure. I guess I can, kind of give a brief intro of what Rejuve AI actually is, right? So what we call it is a decentralized longevity research network. So basically the idea is we're crowdsourcing primarily data from individuals who are either already contributing their health data via various sources, like Apple Health and, all that kind of a thing, or people that are interested in tracking their health data more and, giving it toward an effort that's going to benefit both them and wider humanity. So we're doing that at first with a mobile app where people can connect their wearable devices, log their lab test data, take health surveys, and eventually we're going to layer on some more exotic data types as well, like genomics and epigenetics and glycans and all that kind of a thing. And basically the idea is that their kind of personal profile and the AI underlying it gets to optimize a protocol for them more and more, the more data you provide, and give you the best pathway forward to optimize your health and wellness. Because we have a lot of similarities in the sense of, we all know what it takes to be healthy, but we have different personal requirements, whether they are, allergies or medical things, whether it's social and religious, whether it's lifestyle related, whether you have children or not, how much free time you have, where there's different aspects that can prevent a one-size-fits-all approach for optimizing longevity. So it's that personalized health thread is very well in there. And then you mentioned education too. That also underlies it a lot because in this application, we are teaching people about aging science in ways that we hope they're going to be connecting more to the fact that they have like their personal data pretty much. So it's making their health data more real to them in the sense that we're not just deferring it on to some external party to tell me, what's wrong with me and, what do I do? But it's actually understanding at that physiological level what is happening. And so that conversation with them and their provider gets a bit deeper and a bit more kind of return to maybe how it was, but even just with more illumination.
Yeah. I mean, the whole notion of crowdsourcing data is such a powerful technique, especially in longevity, where longevity science, where many people are trying off-label uses of different things and different strategies and drugs. It reminds me of Matt Kaberlein, who's a researcher on rapamycin, who put together a large crowdsourced database of rapamycin, which of course is a FDA approved drug for all sorts of things, but people take it off label for longevity. And through his crowdsourced thing, they were able to tell, self-reported, but they were able to tell dosage, what people are taking, what side effects they get, and all those sorts of things. And now we've talked about VitaDAO at one point back on other programs. How is this similar to that? And that is a decentralized sort of is that more research oriented for longevity? Are you familiar with that organization?
Yeah, actually, I actually was just part of a DeSci event with them in Singapore just recently. And yeah, the because you maybe quick thing on DeSci, decentralized science is one of the movements that's kind of rising in the blockchain and Web3 space, which is again another evidence that it's getting beyond just scams and flipping tokens and whatnot. We're actually talking about how decentralized science can contribute to increased fairness, reduction of bias, more involvement of more people collaborating together, and actual acceleration of important research such as that for aging. So VitaDAO is actually focused on funding early stage biotech companies. So they tokenize IP in those new companies, and pretty much are accelerating new therapies that are coming on the horizon that will actually make a real dent in ending aging, as people call it. So going beyond just eating your veggies and getting enough sleep and all that sort of a stuff, but something a little bit more than that, that's actually repairing age-related damages. So there's a whole lot of spin outs that are already starting to do things there. So that's pretty exciting.
Yeah. So it's sort of complementary to Rejuve AI then, right? And Rejuve AI then, if I characterize it right, is if I understand what you're saying, it's primarily crowdsourcing science or crowdsourcing epidemiology and epidemiological data to identify potential candidates for deeper research that then VitaDAO could spin out and fund or something with tokenizing the IP and all that. Is that kind of how it fits together, or what am I missing?
Yeah, I mean, well, that's definitely something that could be right. I mean, there's a lot of potential collaborations, but yeah, I would say it's definitely synergistic in the way that, yeah, exactly. We're crowdsourcing data from, you were kind of hinting earlier on N of one trials and that potential, so people that are already trying certain interventions on themselves, whether they be more mild interventions like a supplement stack and a routine, or something more intense like rapamycin or stem cell therapy, that they're able to actually track how that's affecting them, and we can see that how that's going for different people, and actually arrange parameters around it to bring it into the realm of science and be able to write papers about it and use that data for more people. And then of course, the learnings that we get from that, analyzed by our AI systems, is able to indeed kind of point to different pathways and interesting areas of research that could need to be funded more, or looked at more, or just paid more attention to. So definitely.
And so I guess the VitaDAO is funded by potentially investors that come in and tokenize the IP and all that sort of stuff. What's your how is Rejuve AI funded, and how does that work?
Yes, our initial funding was actually from our JV token. So that's our native token that we are also using to reward participants in our network, both for the data. And then we also have a crowdsourcing component of actual models as well. So if there are like AI, we have kind of a thing called a generative cooperative network, where people can add and contribute different models to that system to kind of create systems biology simulations. That's kind of the end game there with that piece. Yeah. So in going forward, as far as like a revenue structure, we'll have a freemium model. So basically, we want to keep a level of the app always free for everyone, to stay true to our mission to, decentralize wellness and health and longevity for all. We definitely, don't want to lock people out based upon their financial ability. And we're also, trying to lower barriers by paying people for data. But we will have premium features, such as those deeper insight analysis that I was mentioning earlier, different features in the app to where, there'll be a subscription layer. There's all kind of different things that we're kind of exploring as it goes with supplement plans, meal plan recommendations, exercise, being able to scan face age, and all different features that we're kind of ideating upon to add value to our initial baseline set of just general health advice, depending on what you entered. And then we also have a affiliate network as well. So we have a wide network of partners already that have kind of joined the ecosystem, and they list their products in our in-app marketplace.
Oh, okay. And what's the timing for the release of the app? You said it was in development. Is there a prototype or MVP available yet, or when do you expect to see something that people could begin interacting with it as a consumer? And to be clear, I guess people can interact with it now as part of the organization. They can buy the tokens and participate that way, right? But from the consumer-facing side, for the app, the person who's just, I want to do health and longevity for myself or my N of one, when will that be available, do you think?
Yeah, so we are, finishing it as soon as possible. And you mentioned as far as the MVP prototype, yes, that's online. It's especially important in our space, in the crypto space, to sort of prove your legitimacy and be very open and transparent. So yeah, our beta is open to all up until the point when we actually bring it out of beta phase and go live. So you can already kind of play around and see how it works. We're already kind of aware of all of our top items that need to be addressed before we call it done. So that is what we are working on currently, and we are still targeting for 2024, early 2025 for the formal launch and opening it to the world for actually meaningful use. But if anyone is interested in beta testing, that's available on our website always.
What are your biggest challenges now that in moving this forward, do you think?
Well, we have, really, it's kind of just, for instance, the synchron of these wearable devices is something we realize is very important to our community, and making sure that all works properly and correctly. We want that in there. And then finalizing our core models. We got some initial feedback, all of the bug reports, all of that sort of thing. So making sure that these models are functioning the way that we actually desire them to, that the results are coming out, accurately, and that, it's kind of staying true to the intention. We don't want to falsely, we don't want to be one of those apps that says it's doing this and it's not really doing it, or put out an app out there that is actually useless and is just, for show. We want it to actually be immediately useful. So I think just bringing it up to that quality standard. And then, of course, in the background, making sure that we handle all of the compliance and safety requirements as well.
Yeah, that's so exciting. I can't wait. What are tease us a little bit. What are some of the wearables you're thinking of integrating? What are your top ones on there, like CGMs and Fitbits, or what?
Yeah, so we started out with Fitbit, Garmin, Oura, and any sort of Apple Watch, Apple Health integration. And then we recently included MyFitnessPal so that people can actually map their nutrition data a bit easier. And we've also put in Google Fit, as long as that, we're integrating Samsung as well. So yeah, we are going to integrate pretty much as people request them. The most popular ones that people want to see there, we'll aim to add them.
And so people can interact then with Rejuve AI. Just to sort of summarize it, they can interact if they're sort of interested in their health wellness aspect. Then they can go to the website, which we'll put in the notes, rejuve.ai, and then interact with the beta version, and eventually a full-on version, and even a subscription version. And then if they're technical people who are, on the blockchain, cryptocurrency, Web 3.0 side, they can like dive in through GitHub and Discord or wherever, and interact with you and get involved on the kind of foundational level with building it out, right?
Yeah, and that's actually gets into a bit of, right now it's called Ambassador Program, but it's just kind of a community initiative to where we have these different prongs that we're reaching out to in our community. Because actually, when we opened our initial beta testing, we actually had a bit of an entry survey, and we found that there was a very diverse skill set in the people that were coming to test. We had clinicians, we had developers, we had business people, actual professional beta testers. There were like a wide range of people. So it kind of sparked this idea to create a program to be able to empower and mobilize all of these different groups. So we already launched our KOL kind of key opinion leader group. So we have people with big social media channels that want to just talk about Rejuve and create content. So that's already going pretty well. We have our moderators who keep all of our channels peaceful and clear of spam and keeping people directed to where they need to go. Our next one that we want to roll out is actually clinicians advisory group. So we want to mobilize all of the doctors, nurses, healthcare professionals in our community around longevity initiatives. So trying to move that forward in real life, in practice, and educating them and just doing what we can to change and shift the paradigm. And then developers, you also mentioned, that's another aspect that, if we have people that want to contribute to the code, we'll have kind of a scheme for them as well to reward them and, track even their participation and contribution to the overall system as well.
So it sounds like, just from the nature of it, from the crowdsourcing, it's so exciting, is you want longevity and health interventions that are done somewhat at scale, that a lot of people are doing them. It's not like have Liz Parrish doing gene therapy on 2 people or something, or you need they can be cutting edge, but they need to be cutting edge things that are done with a fair number of people so that you can get the numbers. Is that what you're thinking about, Ben, with that?
Yeah, exactly. Being able to direct people to what they want to find. Of course, we're not going to promote or tell people, you should do this, that's not already validated with lots and lots of scientific evidence and whatnot. But if people are interested in trying, emerging therapies like that, exactly, to be able to set up proper trials that can be published and replicated and whatnot, so that we can actually get some real findings there. And it comes out of this realm of just, ideation, close to, kind of, could be, and actually have some sort of hard data about how this should be gone about in the best way.
Mm-hmm. And I know, where do you think you will be in 5 years? What's the dream, or what's the long-term big picture of this, do you think? Or the milestones? Pick your horizon anywhere on there. What are you excited about with this in the future?
Well, I'm overall excited about where the DeSci movement is going. Decentralized science, the fact that people are actually doing this and highlighting that there are actual problems in our current paradigm and system. That's all coming out of the realm of conspiracy and all that sort of stuff, but that it's okay. We recognize there's problems with pharma. There's problems with bias and funding and all this sort of stuff. So definitely excited about health and wellness becoming an actual pillar of all of human society globally, and increasing our lifespans to the average lifespans to maximums that they should be already. So catching up there, and then we can actually focus on going beyond that. Now for Rejuve specifically, I'm expecting that this kind of network will truly grow and be kind of, the default ecosystem for participating in longevity research on an individual basis. And also that we have some powerful, robust AI that's giving people amazing insights and recommendations, and that we can actually track that, how it's improved their life over time of using our app, and or even some novel findings in the field that we can publish.
And for the AI, I assume you're using deep learning, generative AI, large language models, sort of what's sort of hot now. That's approach to it, right? And training the models on the health and longevity data that you have and what's out there. Then is that right?
So we do have the advantage of having long-term AI scientists who, it was before any of the kind of new wave of ChatGPT kind of thing came along. So we do have unique models. For instance, our first one is actually a Bayesian network where we've used hundreds of different meta-analyses and grounded in the NHANES study to be able to have some modeling of statistical likelihoods of different morbidity, pretty much. So that's the kind of baseline model. And then, we will be using generative solutions as well, such as variational autoencoders, eventually large language models as well, to kind of, speak it in the terms that are kind of relevant to everyday users, and, being able to highlight certain sections more or less, to talk about them more. And then we have as mentioned, kind of the generative cooperative network where we can merge different types of generative AI into one to kind of talk to each other and be able to, our idea is simulation so that we can actually, for instance, be able to accurately simulate what the effects of such an intervention are going to be to a certain degree of accuracy before deciding to go forward with it or not. So improving safety in that way. And we also have a bit of a inclination to do quantum AI as well. Quantum computing is a bit early stage, we realize, but there are already things happening there. So we definitely want to get into that space too.
Yeah, I mean, so many fun things to talk about here. What I guess just to kind of complete the picture, we talked about VitaDAO, Rejuve AI. Are there any other big players in this space, like in DeSci specifically for health and longevity, or do you see, VitaDAO doing that with funding things and you guys doing that, or are there any other Web 3.0 entities that we should all keep an eye on as well in this space?
Yeah, actually, a lot of them were kind of spun out of there, or they're in some association. There's one called AthenaDAO that's all focused on women health. We're actually going to be having a DeSci space with them pretty shortly, so I'm actually going to learn more about what they're doing. I saw an interesting one that's doing pretty well too, called HairDAO, and they're all about regrowing hair and all that sort of stuff for the cosmetic aspects of aging. So yeah, there's definitely a lot of cool things. Moleculebio.xyz. Yeah, there's several there. If you kind of type in DeSci on CoinMarketCap, if you are inclined to check out cryptocurrencies, you can kind of see the leaderboard currently there, and I'm sure that there are more to come.
And just maybe stating the obvious, but because of the nature of Web 3.0 and the decentralized aspect of it, most of these organizations are built around a token or some sort of currency that then can be monetized or used. So that's why you search for the coin, and then the DeSci, and you'll see all these organizations and all these groups there. I could talk about this forever. I know we're running short of time, but have you experienced any in your own personal life, any breakthroughs as a result of this? Like, whoa, I never thought of that. And, I tried doing this, or anything that this has personally, affected you yet? I know there's a lot. You're just at the beginning. There's a long way to come.
I guess the most impactful part has been, deep diving into this science, just being involved in this community. I get to learn a lot about the cutting edge stuff and also kind of the basic molecular genetic stuff as well, and epigenetics. So that's been really cool to learn. And as far as personally, I mean, one of the main drivers of, making sure this app is, as good as, of course, they say you can't really aim for perfection, or you can aim for it, but at least being useful, because I want this app to be useful for me. I'm a person who I really get excited about supplements. I can go into a health food store and I would want everything on the wall like a kid in a toy store. So I'm thinking, well, that doesn't necessarily mean that I'm getting some real benefit out of this just because it sounds good and I read some good things. I don't know what it's actually doing at a metabolic level for me. I don't know if it's helping, hurting, doing nothing. I can go by subjectively how I feel, but I'd like to have a more precise metric and optimize my supplement stack, because I feel as though maybe people don't really need to be taking 50 or 100 things per day. You probably only need like 2 or 3 that are going to help you the most, and maybe you need to rotate them at some intervals or something like that. So I want to be able to really get down into that aspect and actually make a protocol that works for me and my lifestyle. For instance, as being, a remote CEO who's traveling frequently, often sedentary in between, not really spending much time on on exercise, and can more often going to order food than cook, and all of that kind of a thing. So.
Yeah, for sure. Yeah, wow, this is so exciting. I'm going to go check out the Rejuve.ai website and start looking at the tools, and I can't wait to see all the amazing things you guys are going to do. This is so much fun. Well, I think we talked about how people can get a hold of Rejuve.ai. How about you personally, Jasmine, on social media, or any links or a personal website for you want to share?
My main ones are LinkedIn and Twitter/X. I have like kind of a weird handle called Zolly Dolly, but yeah, I mean, if you kind of look around, you can find me. I think I'm pretty noticeable. So, but yeah, those are my two main platforms, which I interact on is LinkedIn and Twitter. So yeah.
Great. Well, great. Well, thanks so much, Jasmine. This has been a total blast. I love this stuff. I could talk to you forever about this. This is really fun. I think we'll have to schedule another podcast to do an update a few months from now. We can, go over
sure.
all the exciting progress. But I encourage everybody to check out Rejuve AI and thanks again, Jasmine. This has been wonderful. And thanks for all the work you do.
Thanks so much, Rob.
If you are enjoying this program, please hit that subscribe button, or even better, leave a review. Your support makes it possible for us to create the quality programming that we're continually striving for.
Can I start? Is it recording?
It's already recording.
Oh, sorry. This is for general information and educational purposes only, and it's not intended to constitute or substitute for medical advice or counseling. The practice of medicine or the provision of healthcare, diagnosis, or treatment, or the creation of a physician-patient or clinical relationship. The use of this information is at their own user's risk. If you find this to be of value, please hit that like button to subscribe to support the work that we do on this channel. And we take your suggestions and advice very seriously, so please let us know what you'd like to see on this channel. Thanks for watching, and we hope to see you next time. You should say that.
No, that's good. It's for you to say. I think that's very good. You like it? You want to do it one more time, or is that good? I think that was good.
Yes.
All right.
You need to save the recording.